The top baby myth busted. What every new parent needs to know. Before starting, don't forget to like the video, subscribe the channel, and turn on the notifications bell to receive all updates. Becoming a parent is a journey filled with excitement, wonder, and sometimes a whole lot of conflicting advice. From well-meaning relatives to online forums, everyone seems to have an opinion on what's best for your baby. However, not all advice is grounded in facts. Let's unravel some of the most pervasive baby myths to help you navigate parenthood with confidence. Myth 1. Babies should always be fed on a strict schedule. One of the earliest pieces of advice new parents receive is to establish feeding schedule for their newborn. While some routine can be helpful, rigid schedules can be impractical and stressful for both baby and parent. Pediatricians often recommend feeding on demand in the early months to ensure babies receive enough nutrition and to support their natural hunger cues. Research shows that babies have varying appetites and growth spurts, which can lead to fluctuations in their feeding patterns. Responsive feeding, where caregivers tune into babies' hunger and satiety cues, is crucial for healthy development. This approach fosters a trusting relationship between parent and the child and supports optimal growth. Myth 2. You should wake a sleeping baby to feed. Newborns sleep a lot, often up to 16 to 17 hours a day. Many parents worry about waking their sleeping baby to ensure they are eating enough. However, experts generally advise against waking a baby to feeds unless medically necessary, such as if baby is premature or not gaining weight adequately. Babies are typically good at waking when they are hungry and regulating their feeding needs. Forcing a feeding schedule can disrupt their natural sleep patterns and lead to unnecessary stress for both parent and the child. Instead, trust your baby's instincts and seek guidance from healthcare providers if you have concerns about their feeding habits. Myth 3. Giving a baby solid foods will help them sleep through the night. The idea that introducing solid foods early will encourage longer stretches of nighttime sleep is a common misconception. The American Academy of Pediatrics recommends exclusive breastfeeding for about the first 6 months of life, and then gradually introducing solid foods while continuing breastfeeding for the first year or longer. Babies' digestive system develop at different rates, and early introduction of solids before they are ready can increase risk of allergies and other health issues. While every baby is unique, sleeping through the night is a developmental milestone influenced by many factors beyond just diet. Parents should focus on responsive nighttime parenting and seek guidance from pediatricians for strategies to support healthy sleep habits. Myth 4. Babies need to be fully bathed every day. While keeping babies clean is essential for their health and well-being, daily baths are not always necessary, especially for newborn. In fact, frequent bathing can strip their delicate skin of natural oils and lead to dryness or irritation. For most babies, a bath 2 to 3 times a week is sufficient to maintain cleanliness. Paying attention to diaper changes, keeping their face and hands clean, and wiping down their diaper area after each change are effective ways to keep babies fresh between baths. Myth 5. Babies need to be fully awake during the day to sleep better at night. It's a common belief that keeping babies awake during the day will tire them out and promote better sleep at night. However, newborns and infants have limited awake windows due to their developing brains and need for frequent sleep cycles. Trying to keep a baby awake when they are naturally drowsy can backfire, leading to overtiredness and difficulty settling down for sleep. Instead, following a constant daytime routine that includes plenty of opportunities for naps in a sleep-friendly environment can help babies develop healthy sleep patterns over time. Myth 6. Adding cereal to a bottle helps babies sleep longer. Historically, caregivers have added cereal to babies' bottle with the belief that the thicker consistency would keep them fuller and promote longer sleep stretches. However, there is no substantial evidence to support this practice, and it can pose risks to a baby's health. Introducing solids should be done gradually, following recommendations from healthcare providers and based on baby's developmental readiness. Adding cereal to a bottle can increase the risk of choking, overfeeding, and digestive issues. It's essential to prioritize safe feeding practices and seek guidance from pediatricians before introducing solids or making changes to a baby's diet. Myth 7. All babies should sleep on their backs. The Back to Sleep campaign, launched in 1990s, significantly reduced the incidence of sudden infant death syndrome by encouraging parents to place babies on their backs to sleep. However, some caregivers may worry that back sleeping can lead to flat spots on the baby's head or other concerns. Pediatricians recommend placing babies on their backs for every sleep time until they can roll over on their own. This position reduces the risk of SIDS and promotes safe sleep practices. Providing supervised tummy time while the baby is awake and alert can help strengthen neck muscles and prevent flat spots. Myth 8. Babies cry for attention. Crying is a baby's primary means of communication, signaling needs such as hunger, discomfort, tiredness, or overstimulation. While it's natural for parents to want to soothe their crying baby, crying is not manipulative, but rather an essential form of expression. Responsibly attending to babies' cries help build trust and security, fostering a strong attachment between parent and the child. Understanding and responding to their cues can help caregivers meet their needs promptly, promoting healthy emotional development. Myth 9. You can spoil a baby by holding them too much. Contrary to popular belief, you can't spoil a baby by responding to their needs promptly, including holding them when they need comfort. Babies rely on caregivers for security, comfort, and regulation of their emotions and physiological needs. Responsive caregiving helps babies to develop a secure attachment, which is crucial for their social, emotional, and cognitive development. Holding, cuddling, and responding promptly to a baby's cues promote feelings of safety and trust, laying the foundation for healthy relationships later in life. Myth 10. Exposing babies to cold air will make them sick. While it's essential to keep babies comfortably warm, being outside in cold weather doesn't cause colds or illnesses directly. Illnesses caused by viruses or bacteria that are spread through contact with infected people or surfaces. Keeping babies appropriately dressed for the weather and avoiding exposure to sick individuals can help reduce the risk of illness. Fresh air and outdoor activities can be beneficial for babies' overall health and well-being, provided they are dressed appropriately and protected from extreme temperatures. Conclusion. Navigating parenthood involves sorting through a myriad of advice and information, some of which may be outdated or based on myth rather than facts. By understanding and debunking common baby myths, parents can make informed decisions that support their baby's health, development, and well-being. Goodbye.